All right, now, Patriots, this story is taking a break from the political videos that I usually put up because this is extremely important and could impact you or somebody that you know or loves life far more than what you may know. I'm not sure if you're aware of it, but recently the FDA just recalled close to 1 million bottles of blood pressure medications because they claim they have cancer-causing agents in them. As you can see, the title of this video, drug makers recall blood pressure medication tainted with cancer-causing chemical, the FDA says. So in this video, I'm going to show you the video clips reflecting what's going on, and we're going to go over the list of the medications that are being recalled. That way, if you or anybody you know that's on blood pressure medication can make sure, A, that you're not taking these, and if you are, you can get with your doctor or do whatever you need to do to start, investigating better options for you than that specific one. So we're going to get into this. So make sure you hang in there with me. So I'm going to read some of this article right here, then we get into the video clips. The Food and Drug Administration say drug makers have recalled more than 500,000 bottles of the blood pressure medication Prazosin Hydrochloride over concerns it may include a cancer-causing chemical. New Jersey-based Teva Pharmaceuticals USA and drugs distributor Amerisource Health Services issued voluntary nationwide recalls earlier this month of more than 580,000 bottles of various strengths of Prazosin capsules, according to the FDA. Doctors prescribe Prazosin, which relaxes blood vessels to help lower blood pressure. It also sometimes prescribed for nightmares and other sleep disturbances caused by post-traumatic stress disorder. The FDA said in enforcement orders posted online that it has given the affected lots of the drug a class 2 risk classification because some of the recalled medication may have nitrosamine impurities that are considered potentially cancer-causing. According to the FDA, N-nitrosamine impurities are a class of potentially cancer-causing chemicals that can form during manufacture or storage of a drug. So if you have somebody that has PTSD, or if you have blood pressure issues, if you've been taking Prazosin, or what was the other one, nitrosamine, you may want to consult with your medical doctor. But that's just, when I saw this, the fact of the matter is, of the number of seniors that I know, that I interact with, that I care about, this is extremely important because you may be shocked by how many people that you may know personally that's taking one of these medications. But let's check out this news report that dives into it a little bit more and breaks it down for us. Check this out.
Called more than 500,000 bottles of blood pressure medication.
Yeah, there is concern the medication may contain a cancer-causing chemical, something we've been talking about just the last few days, but a lot of you still have questions.
Understandably so. Sherman Chow, she just spoke with an expert. Sherman, should people just stop taking this medicine immediately?
No, doctor says that is not a good idea, and here's why. These capsules help relax blood vessels to facilitate blood flow. That helps to fight the high blood pressure, and it's something most people on these meds need to actively manage. Well, now to the concerns that prompted this recall. These capsules may contain nitrosamine impurities. Those can develop during manufacture or storage and can cause cancer. Teva Pharmaceuticals USA and Amerisource Health Services have voluntarily recalled 580,000 bottles of Prazosin Hydrochloride. We are talking the 1, 2, and 5 milligram doses, and now we are talking longer term use. Dr. John Higgins, a cardiologist at UT Health Houston, has not heard of anyone developing cancer from these drugs. Here's what he does know.
I have definitely heard of people that have had adverse effects from suddenly stopping these medications. Get a game plan for how they're going to wean you off this and onto another medication, which will be effective for you, but without this added kind of long-term risk.
A couple of side notes. Nitrosamine is linked to cancer, but we also consume it in bacon, sausage, smoked fish, alcohol, but in smaller quantities. The concern, the quantity and the duration. And Dr. Higgins wants to remind us that eating right, reducing salt, exercise, good sleep, moderate alcohol intake, all of that improves your blood pressure, can even get you off the medications. Of course, it is a little bit more work than popping a pill. Guys?
Yes, it is, but it is a good thing. Thanks for the expert advice there, Sherman.
Now, I noticed in that video that she even said reducing salt. Now, my mother's a nurse, my wife is a nurse, my mother-in-law is a nurse, so and all of these nurses are 25 years. My wife is the lowest experience with around 20 to 25 years. My mom is almost 40 years. My wife's mother is almost 40 years in the nursing industry. So they're always looking at ways to, combat the use of taking medications because they've seen the great things it can do, but they've also seen the downside. And my wife introduced a lady to me by the name of Barbara O'Neill. You may be familiar with who she is because or maybe not, because she is a true person that's committed to helping people live better. She's not big on social media. Other people take her stuff, clip it up, and promote her stuff, taking credit for her work. And she's extremely humble. She refuses to play the game of trying to be a social media star. She just wants to help people. And so when the lady just made that statement in the news clip about reducing salt, it's not so much as the salt intake as to what kind of salt. But in this next clip, and remember, I'm not a medical doctor. I'm not giving medical advice. Whatever your physician has said for you to do, you follow that until you get other instructions. Now, in this video clip, Barbara O'Neill is going to speak about blood pressure and some of the things that we can do that does not or may not require any medication at all to really start helping our bodies overall. And it's going to shock you when you hear this one simple trick. And I do it. My wife has bought it. We do it. I use it. So just check this out from Barbara O'Neill. Patriots, if you enjoyed the video, do me a solid. Remember to hit that like button. And if you aren't subscribed to the channel, subscribe. And when you subscribe, make sure you hit the notification bell and select all. YouTube has issues getting notifications out, but when you select all, YouTube will make sure that you get notified when I upload new videos.
So when people come to me with high blood pressure, I put them on Celtic salt because Celtic salt contains 82 minerals. It contains magnesium chloride, magnesium bromide, and magnesium sulfate. And because magnesium is a water-hungry molecule, it can be used to help the water get into the cell. So when you take a crystal of Celtic salt, put it on your tongue, your mucous membranes start absorbing the minerals, the magnesium is taken to the cell membrane, and you drink your water, and that magnesium pulls that water inside the cell. It's the quickest way to hydrate a body. The only time excess water drinking can be dangerous is if people drink too much at once and don't have the minerals that are in the Celtic salt to pull that water inside the cell. So when people come to me with high blood pressure, I put them on Celtic.
Now, the Celtic salt, we have that. My wife, I have it. I use it for my waters because my wife was like, hey, put this on your tongue. Then she showed, my wife got the Barbara O'Neill books, all of that stuff, a lot of that remedies. And I have to admit to you, whether it be from hydration, or even, getting my blood pressure taken, it significantly helped me to where, my goal is to never have to take any of those medications, but some people have to. And that's even more important as to the partnership that I recently came into with Chapter. Now, the reason why this is so critical with the reports of the FDA recalling blood pressure medication, you've got the Medicare issues going on with the federal government. And then you've got our senior citizens that are out here, many who may just now be having to consider what are they going to do as far as for their health insurance. They have their Medicare, but what are they going to do to take care of the other, supplement the other, the rest of the care that they may need? What if their physicians are out of network with whoever the company is that they're with? Chapter, they give you an unbiased perspective to make sure that you have the best health care available to you. It doesn't cost you $1 to make the phone call, and in less than 20 minutes, one of those experienced agents will give you an unbiased perspective, making sure that you have the best healthcare plan available. Guess what? If what you have works great, fine. But wouldn't it suck to find out months from now, a year from now, that you've been investing in a plan that no longer covers your prescriptions, or your doctor is not even in network anymore? And so, and with open enrollment period being right now, it's extremely important to make sure that you jump on top of that. So I highly encourage you to just check out Chapter. Give them a call. Like I say, the phone call is free. And in less than 20 minutes, one of those agents can help you make sure you've got the best Medicare plan available to you. So now let's get off into the list of the medications that were actually being recalled, because they spoke of that one, but here's some other information. Recent blood pressure medication recalls include certain batches of Acupril and Acuretic due to nitrosamine contamination, and lisinopril and hydrochlorothiazide. I apologize, y'all. You know these medical terms. Hydrochlorothiazide from Lupin Pharmaceuticals for a voluntary recall. Older recalls involve various brands of valsartan and losartan due to contamination. For the most current information, check the FDA recalls page. So specific recent recalls, like we said, Acupril and Acuretic, Lupin Pharmaceuticals, valsartan, losartan, and then the medication that we spoke about in the first part of the video. So I just wanted to share this with you again. I know we typically are all about politics, but health as well. So I wanted to bring this to you so that way, if somebody you know or love is on one of those medications that was in the article, have them, you yourself, or have them consult with their physicians and see what their alternative is, before anything drastic or before, something negative happens. Other than that, if you've hung out and you watched this video, I want to say I thank you from the top and bottom of my heart, because this wasn't about the political rah, rah, rah. This is helping our people because the people that watch my channel, I genuinely care about you. We don't have to meet for me to know you. And the fact that you take time out of your busy day and schedule to spend time watching these videos and supporting the channel, I greatly appreciate you. I humbly thank you. And the least I can do is share information because I know a lot of people that watch my channel are people that are seniors. So this is extremely important. My mom, my father, this is them. So just wanted to bring this to you. If you haven't already, hit that like button. Help us spread this video around. If you aren't subscribed to the channel, subscribe. Most importantly, please be great and be safe. I'm Brian Maxwell saying I look forward to seeing you at the top. Over and out, y'all.